Doug Fry, and what we're talking about today is the use of this small little device, which is basically called a hook knife, and how I do carpal tunnel releases to take pressure off the median nerve as it comes through the ligaments that are across here. So the carpal ligament comes across like that, and the median nerve comes down and goes here, and it goes to those 3.5 fingers. And so people get numb in this area. And when there's pressure in this area here, the ligament can be cut to reduce the pressure, because there's 9 tendons in there that are all very dense and stiff, as compared to one nerve, which is very soft and pliable. So when there's extra pressure in the carpal tunnel, the nerve gets pinched, and that's why people get numbness and pain in their hand. So the normal way to solve that surgically would be to make an incision in your hand, basically like this. So it'd be about from here to here, and release this ligament with a knife, and then sew this up, boom, 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 and put you in a splint for a week or so, and then have you come back in a couple of weeks and get your stitches out, and then hope that you don't have a lot of scar pain. So what we do with this knife is to use the ultrasound, and the ultrasound allows me to look and see all kinds of problems anatomically. Let's look over here first. This is the ulnar artery, right here, this little round circle. This is the median nerve. The ligament is this little dome coming across here. All these little things in here are tendons coming straight at you, and these are the tops of the bone. So I can see all the anatomy. I've measured here that this is 5.4 millimeters from the nerve to the artery. Well, this is 2.6 millimeters, so I can stick this in between these without having a problem. I just have to be careful as I'm going. And I look at the ultrasound both lengthwise and shortwise. So as we go through this, here, I'm going to take, and here's the artery and the nerve, and we'll go to the next one. And this is how I'm anesthetizing the skin above right here. So I'm coming in with a little bit of a skinny needle, and I'm going underneath the skin, but on top of the ligament. And you can see the local anesthetic going in there. This is a shot. There's the nerve. There's the artery. I'm going to be coming in right here. Okay, so now I'm going to be injecting underneath the ligament. This is ligament going lengthwise. Here's tendons going lengthwise. And here's the needle coming in. I've already anesthetized here, so you're not feeling anything down here. And I'm anesthetizing along the median nerve in the carpal tunnel. Okay, so here's the ulnar artery. Here's the median nerve here. And here is the tip of the knife poking its head out towards you. You can see little metallic echoes beneath it. So I can tell exactly where I'm going between the artery and the nerve over here. And there I am right there. And now I've got the hook. This is lengthwise. This is the hook. Here's the tendons. And I'm pulling through the carpal ligament. And you'll see a little bit more of it as I come through here. There's the hook. So I'm just pulling this direction. And the end of the ligament is right here. And there's the very end of the ligament. And then if we go back down again, I'm making a second pass because I went with a probe and couldn't get all the way through that ligament. So here's the second pass. Here it goes, pulling through the ligament. So I've got the full thickness now, which you should be able to see here, me going straight through the ligament with a probe, up and down. So this is the ligament coming across there, and you can see I've cut all the way through. So that's a carpal tunnel release done with a hook knife under ultrasound guidance. As far as I know, we're the only people in town, or even close to here, that are doing this procedure. But it saves pain, it saves skin and scar, and it saves a lot of money. So if you want to go to the hospital and pay thousands of dollars to get this done and end up with a scar, that's one way to go. Or you can come see us and have us do this ultra minimally invasive carpal tunnel release under ultrasound guidance. Give us a call, 271-8100.